The monkeypox virus is a growing concern for parents as kids go back to school. Health officials in Harris County, Texas, say a presumptive positive case there could mean that now at least 7 children in these United States have now tested positive for monkeypox. That child in Texas is expected to make a full recovery, by the way. In all, adults and kids, there are now nearly 13,000 monkeypox cases nationwide. For more on all of it, Dr. David Agus joins us now. Dr. Agus, good morning. Monkeypox, kids, what's your level of concern?
Good morning, Tony. So I want parents not to worry, but to be aware, and I think that's what's critical. So monkeypox is only spread when you touch a rash. And so it's not really spread through the air or through surface as well. And so the key is that if you or your child have a rash, if it's a rash, you need to go to your doctor and to get that swabbed and tested if it's an unexplained rash. And I think that's critical, and we will stop it. But when you look at the cases globally, 99% are in adult men, and 97% are in men who have sex with men. So children, it is remarkably rare.
That's good to hear. For parents and teachers who are concerned, what common sense steps can they take to help protect kids?
Well, common sense is, again, anybody who has a rash, keep saying, make sure you do not come to school with that rash. And if it's unexplained, there's no cause for it, it should be tested. But washing hands. You know, when children finish the play period, they should all go and they can wash their hands, and we can dramatically stop any risk of spread. That simple washing of the hands, as we said, with every viral outbreak, has a major role.
Dr. Agus, the first case of polio in a decade was confirmed here in New York City, found in the city waterways. Should we be concerned about this?
Yeah, Nate, this is really concerning. I mean, because this is the first symptomatic case of a person who developed paralysis, a young adult, from polio who was unvaccinated. And there are parts of the country where vaccination rates in young kids is 60, 70%, whereas it really needs to be in the high 90% range. And when there's one case of paralysis, which means there are probably hundreds of cases of polios in those underlying regions. So we have to push for these vaccines which work.
So if we're not vaccinated against polio, then that is concerning when it comes to this?
Yeah, you could said it, is that yes, is that when you're not vaccinated for polio, this virus can cause paralysis and serious ramifications. And the vaccine campaign, which began in the 50s, was remarkably successful, and it worked, although now we're seeing it come back because some counties in this country have a very low vaccination rate for a number of reasons. We have to target those counties and get vaccines in the arms of young children, and then this will not be a concern. But it's happening now in Britain, it's happening in Israel, and it's happening here in the United States.
Dr. David Agus, thank you for this valuable information.